Association in Seoul in South Korea. He aims to use his expertise and knowledge to serve his patients. His areas of expertise include endoscopic procedures like URSL, PCNL, TURP, TURBT, RIRS, and HOLEP, and minimally invasive open reconstructive surgeries. We have Dr. Sankapal here, and welcome to Health Live at Seniors today. Dr. Sankapal, how are you?
Good, sir. Good, sir.
This is, we've invited you specifically because this is the Prostate Cancer Awareness Month. And we've had some sessions on cancer in the past. And the general, the view of what doctors have said is that prostate cancer affects a large number of males, especially senior citizens. And I thought it would be interesting to have you here today to talk about prostate management in seniors and dealing with prostate cancer. We would like you to make a presentation and speak to our people. And then those of you who have questions, please put them in the chat box in the Q&A tab, mentioning your age. And if you have any specific questions, we will address it to Dr. Sankapal. As always, as I mentioned, remember, this is a session which is advisory in nature. And while, we've had in the past questions about specific medicines and what patients should do, but do remember that this is finally a webinar. It's an advisory session. If you have any specific questions concerning your, if you have an ailment, then you must visit a doctor or interact with doctors. Do remember that, in this day and age, you also have teleconsults available, and you can consult a doctor via Zoom, via various platforms, and I'm sure Dr. Sankapal also would be available at the Fortis Serenanani Hospital. With that, as an important announcement that we always make, over to you, Dr. Sankapal, for your presentation. After the presentation is over, you can put in your questions and we will address it to the doctor in the house. Thank you. Over to you.
Yeah. Thank you, sir. Thank you, Padmanabhan Maheshwari, sir, for inviting here and introducing me here for the Senior Society. Today, September month, that is Prostate Awareness Month, Prostate Cancer Awareness Month. I'm just briefing about the prostate cancer, which is specifically which most commonly occurs in the elderly males. So before my presentation, I'll just highlight about the prostate and prostate enlargement in the elderly men, and then I'll go ahead with the prostate cancer. Let's start our presentation. Next slide, sir. Okay, before prostate, I'll just introduce about urology and what urology is here. Urology is a super specialization which includes the diseases of male and female urinary tract. This urinary tract includes from the kidney, ureter, bladder, prostate, and seminal vesicles and testes. And this, again, we have specialization in urology, like female urology, male infertility section, and neurourology, pediatric urology, and oncourology. Next. And what we do is, we are dealing with the disease which are associated in the urinary systems in both men and women. This urinary tract includes kidney, as I told, kidney, ureter, bladder, and as well as male reproductive system like penis, prostate, and testicle. There are a lot of confusion whenever I have seen during my practice that patient, specifically elderly men or women, they get confused between whom to consult, for whether to consult a nephrologist or urologist. Some diseases, like what we urologists treat, is the surgical part of the urogenital system, which affects kidney, ureter, bladder, specifically cancers or stones anywhere in the kidney, urethra, bladder, or infertility in men, and prostate diseases. What nephrologists do is they treat the medical condition which affects the kidneys, like diabetic nephropathies, hypertensive nephropathies, those which causes increase in the creatinine. They should consult the nephrologist. Now coming to prostate. Before going to prostate, I'll just introduce about the prostatic anatomy. This is a small walnut-shaped gland which is present between the bladder and urethra, which surrounds the urethra, and it produces the fluid that transports the sperm during the ejaculation. Till the age 50, the size of the prostate is approximately around 18 to 20 grams. After the 50 years, so yeah, once the age increases after 50 years, the size of the prostate gland also increases. So it might increase from 20 to 30, 40, 50, sometime 100, sometime 150, and we have seen till 250 also. So in common, we call it as a BEP, that is benign enlargement of the prostate. Okay, that is also called as BPH, that is pathological name as benign prostatic hyperplasia. So as we have seen here, the prostate is just lying below the bladder, in between the urethra and bladder. So once the prostate enlarges, it compresses the urethra all around, and it causes the symptoms like, those are called as lower urinary tract symptoms. Again, we can see there are voiding symptoms and storage symptoms. Voiding means patient will get symptoms of voiding, like he has a poor flow, thin stream of flow, or he has to stop in between passing the urine, that is called as intermittency, or he has to strain while passing the urine, or there might be sense of incomplete voiding of the urine. There are other symptoms like storage. These are because of the bladder issues, secondary to either prostate or bladder issues. Those might be frequency, that is patient has to go to bathroom every half an hourly, 1 hourly, or urgency, urge for the urination, or nocturia. Nocturia means if patient is getting up at the night for more than one time for the urination, he has to get up from his sleep. That is called as nocturia. Many of the elderly men thinks that with the age that is normal. That is not a normal. If he is getting up more than 2 to 3 times, that is abnormal. He should visit his urologist for those symptoms. So these are the symptoms basically. As I have told, there is a weak urine stream. Frequently he has to void, or there might be dribbling after the urination, urgency for the urination, and sometimes patient can get a urinary retention, which might cause leakage of the urine, that is called as overflow incontinence, or frequent urination at the night, that is called as nocturia. So here is a small video about the symptoms. Okay. Okay. So once patients comes with these symptoms to our clinic, so what we urologists do is we do the clinical assessment for the prostatic enlargement. Usually, if it is more than 50 years, we go ahead with the digital rectal examination, in which we do the per rectal examination to find out the prostatic size, whether the structure of the prostate, that whether it is a smooth, hard, or any nodularity, which might indicate the presence of the prostatic cancer. Second, we do a blood test that is called as prostate specific antigen, which we usually do it for the screening of the prostate cancer. It should be recommended that if patient is having more than 50 years, he should regularly undergo a PSA screening test every yearly, followed by urine test, either urine routine or culture to look for any urinary tract infection, and lastly, urine flow test, that is called as UROFLOWMETRY, in which we see whether patient's flow is normal or abnormal. In here, next. Here, patient has to void in a commode, which is kept in a toilet, means separate toilet, where there's separate sitting arrangement for the male and female, and patient has to void once he get the full sensation of urination. Okay, here we get a, once patient urinate, we get a graph which indicates whether the flow is good or not. Ideally, the normal graph is bell shape. That is a normal flow for all the means normal urination. If the flow is reduced, then the graph indicates that there is a decrease in the flow, in which indicates that patient is suffering from the poor flow. Next. These are the different graphs which indicate what patient is suffering from. Normal is bell shape. If it is a because the obstructive flow or poor flow secondary to prostatic enlargement, we get a graph like second one. And there are other patterns we will come to, means we will see in the different patterns in the uroflowmetry reports. And we also advise patient for the ultrasonography to look for the prostatic enlargement, means how much prostate size in that patient and how much he is voiding, means after voiding also how much urine he is retaining inside the bladder, that is called as post-void residue. And sometimes we see the bladder wall thickness, sometimes because of the obstruction patient's bladder wall is thickened. Here we can, in second part, we can see the enlarged prostate. Now coming to the treatment for the enlarged prostate, there are the medical treatments like for the prostate and bladder separately. For prostate, we give the drugs to relax the bladder neck, and second is to shrink the prostate size. If the prostate size is more than 30, we advise for the drugs which shrinks the prostate. And other patients, if they are suffering from the poor flow or other voiding lower urinary tract symptoms, then we advise those patients like tamsulosin or silodosin. Those are called as alpha blockers. And to shrink the prostate, we advise 5-alpha reductase inhibitors. Secondly, if patient is having bladder symptoms like storage LUTS, what I have told is like frequency, urgency, nocturia, we advise them bladder muscle relaxant. Those are called as anticholinergics or beta agonists also. Next. Now, coming to the complication, what if patient doesn't undergo the treatment for the enlarged prostate? So, because as I have told, because of the enlarged prostate, it will compress the urethra and patient will get the symptoms. What if we don't treat those symptoms? Patient will develop slowly, as I have told in the image. Patient will retain more urine inside the bladder. That will cause the more urine will be backflowing inside into the kidney, causing those are called as obstructive uropathies like kidney failure, increase in the creatinine. And as the opposite image, the other image which is showing, the patient might develop the diverticular because of the increased pressure inside the bladder. The mucosa will pop out from the bladder outside to the outside. So those are called as diverticular. And second is because of the more urine storage, patient might develop the recurrent urinary tract symptoms, urinary tract infections, and bladder stone inside the bladder. Next. So these are the medical treatment, and when patient should look for the surgery. So what are the indication for enlarged prostate surgery? One, if the patient is developing urinary retention, once he develops retention, we put the catheter for the relief of the retention, and we give medication and will remove the catheter after 3 to 5 days. So if he is voiding, then we'll keep him on the medication. If he fails to void, at least with the one attempt of catheter removal, that patient requires the surgery. Second, if patient is getting recurrent hematuria means blood in urine. If he is getting recurrent episodes of blood in urine due to enlarged prostate, that patient requires surgery. If patient is again, he is developing because repeat attacks of the urinary tract infection, that also patient requires surgery. Some patients will be having bothersome symptoms, as I have told, voiding symptoms, straining, incomplete emptying, poor flow, intermittency. Those are, if patient is having these severe symptoms which are not treated with the medicine, those patients also require surgery. Other indications are like bladder stones, diverticulum, which I have told earlier, and renal insufficiency due to prostate enlarged. Then that patient also required surgery. So next. So what is surgery? Surgery which we do for the prostate is called as TURP, that is transurethral resection of the prostate. This is most commonly we do in the elderly male for indicated patients. What we do exactly is we'll put a scope, okay, through the normal passage, that is urethra. There is no cut outside the outside anywhere in the body. We'll put the scope through the urethra only. As shown in the second picture, the scope will go till the prostate. That is orange color is the prostate. Till we reach till the prostate. Once we reach, then we visualize, we assess the enlargement, how much enlarged it is. Then we slowly resect the lobes of the, there will be usually two lobes. We resect separately two lobes uh, one by one. Then we'll create a cavity for the smooth passage of the urine. Usually after the surgery, we keep catheter for 3 to 5 days. And once we remove the catheter after 5th day, patients usually 99 to 100%, he usually pass the urine smoothly. Next. So this is how we do, this is how it looks inside the cystoscopic view. That is, this is the first image is showing the enlarged median lobe of the prostate, and second image is showing the resection of the prostate. Third, we are seeing the lateral lobe resection, and fourth, this is the after complete resection, we can visualize the bladder from the cystoscope. That is normal complete resection of the prostate. So this is our OT setup for the TURP. Next. So as I have told, TURP we can do till 100, 120 gram like that. So what if the size is more than 150 gram, 200 gram? So we have recent technology like HOLEP, that is laser surgery for the prostatectomy. We can do laser till 200, 250, 300 also we can do without much complication. There are other methods which previously used to do was open prostatectomies. Means we have to, there will be an incision over the abdomen through which we go inside and remove the prostate altogether. So what are the tips for healthy prostate? This I advise for all the patients whenever come to clinic, like they have to empty the bladder properly while peeing. Sometimes patient goes to the private or some common bathroom, there they hesitate to void completely. Such situation, or at home also, if they don't void properly, they will get again repeated urinary tract infections. So I usually advise empty the bladder properly while peeing. Second, given medication should be taken properly. Some patients, once they get relieved, they stop the tablet for 1 month, 2 months. Again, they will start whenever required. That should not be done. Third, avoid fluid intake 2 hours before the bedtime. So if they avoid fluid intake 2 hours before, then the frequency of getting up at the night is reduced. Then bladder irritant should be stopped, like caffeine and alcohol beverage should be stopped. Healthy diet should be followed, and as much as possible stay warm, because cold climate or cold environment can cause the bladder contraction, which can irritate the bladder, causes the frequency, urgency, and nocturia also. Next. So now coming to prostate cancer. September, as I have told, is a prostate cancer awareness week. So I'm just highlighting the points here regarding the CA prostates. The main cause for the CA prostates are obesity, the increased age, family history, and lower levels of vitamin D, repeated attacks of prostatitis, and elevated level of testosterone levels. Next. So what are prostate cancer symptoms? How they present to clinics? Majority of the times, patient will be not having any symptoms in early stage. They look very healthy. They are very fine in the external look, but they might be having hidden prostatic cancer during the sometime during the health checkups, or during the once they come for the clinic for other evaluation like enlarged prostate evaluation. Those time we detect most of the CA prostates in the early stage. What are those symptoms? Usually they present with the, if at all they present with the symptoms are blood in the urine, or the symptoms of the enlarged prostate like frequency, urgency, and straining, poor flow, and sometimes patient can come with the urinary retention also. Next. So how we diagnose the CA prostate? One, as I have told, for we do the per rectal digital rectal examination to look for the consistency of the prostate, any nodularity is there on the prostate, or size of the prostate. Second is transrectal ultrasound to exactly localize the any nodularity in the prostate, or sometime during the biopsy it will be helpful. Third, in a suspicious case, like third, we do the blood test, screening test, that is prostate specific antigen, which is most commonly done, recommended in more than 50 years of the age. Normally, the PSA value is 0 to 4. The borderline high is 4 to 10. And if it is more than 10, then we should suspect a CA prostate. In a suspected CA prostate, if it is a suspicious or suspected, then we advise them for the TRUST biopsy, that is transrectal ultrasound guided biopsy of the prostate. In a borderline high, if we are suspecting prostate cancer, then we do the MRI prostate also. Next. So what are the possible treatment for the prostate cancer? The prostate cancer treatment is depends on the PSA value, the Gleason score on the prostatic biopsy, and the stage of the prostate, whether it is confined to the prostate or locally advanced or metastatic. So what all options we have are, if the PSA is less than 10, or if it is early stage, and if it is a male, if it's the age is 80 or 85 or 90, and patient is fit, then we can keep him on the active surveillance also. Or if it is an early stage confined to the prostate, we can do the prostate surgery like prostatectomies, radical prostatectomies with lymph node dissections. We can do it either open, laparoscopic, or robotic surgeries. There are methods for radiation therapies also for the prostatic cancer, like after surgery, or if it is a severe bony pain, we do the radiation, low focal radiation. And the hormonal therapy, that is androgen deprivation therapy, depends on the stage, depends on the status of the patient. We advise these hormonal therapies, and chemotherapy and immunotherapy depends on the what stage patient is having CA cancer. We advise them accordingly. Okay, so this is regarding the CA prostate. So when you should visit the urologist in general. So when your patient is seeing the blood in urine, that is a red flag for that patient. He should visit the urologist as soon as possible. Second, pain in the lower back, pelvis, side of the abdomen or lower abdomen. Third, as I have told, urine problems like burning micturition and lower urinary tract symptoms like frequency, urgency, or urinary leakage, difficulty in holding the urine, weak flow of the urine, or inability to urinate, like retention, and frequent urinary tract infections. Apart from this, if patient is having male infertility or mass or pain in the testicles, he should visit his nearby urologist as soon as possible. Okay. So hereby I am concluding my presentation.
Thank you very much, Doctor.
Thank you, sir. Thank you, sir. Thank you very much.
for this presentation, Doctor. I will just, Doctor, we've received quite a few questions that have come in. Can I start taking the questions?
Yes, sir.
Just 1 second, Doctor. 1 second. So we have a question from Mr. S.K. Agarwal. He is 77. His question, he says, T2D and HTN since 32 years. HbA1c is 7.1. Diabetes controlled by oral lingliptin and long-acting insulin. KFT, LFT, CBC always normal. BPH since 2012, suffering from micturia, taking xylitol 8 mg daily. EGFR was 71 in February 23 and now 63. Doctor, he's asked for suggesting any medicine to check for diminishing of EGFR and any other suggestion. I know we don't want to suggest medicines, but is there something that you would like to advise Dr. Agarwal, Mr. Agarwal?
Okay, sir. Yes, sir. He is suffering from, that's why I have initially told also, the symptoms of the BPH. He is having BPH. He is taking, I think he must have recognized Noxuria. And he is taking already silodosin and EGFR was 71, that is come down to 63. The best way to see for effective GFR is to do the DTPA scan. But ideally, I feel he should visit a nephrologist for those things. As I have told in the first slide, we are dealing with the BPH symptoms, prostate cancers and all, but the GFR part, the creatinine level, GFR part should be better handled by the nephrologist. So I feel he should visit a nephrologist once for further management.
Thank you. We have a question from Mr. N.N. Ravindranath. He is 79. His question is, what is the recommended size of the prostate gland?
Okay, sir. As I have told, the prostate size is usually 18 to 20 gram till the 50 age. So after 50 age, the gland size is gradually increases. It might increase to 30, 40, 50, 100. But what he should think about is how much symptoms he is getting because of the prostate. We are not taking the prostate size because sometimes even though it is a 150 gram also, patient will be not having symptoms. So we are not treating those 150 gram prostate. We are treating his symptoms, how much symptom he is getting because of the prostate. So I feel he should see how much symptomatic he is because of the size. Size can vary, sir. It can vary from 30, 50, 100, 150 also.
Right.
There is no fixed size for the age related. Like.
Doctor, we have a question from Mr. Satish Puri, who asks for chronic prostatitis, which doesn't respond to antibiotics. Do you recommend removal of the prostate?
Sir, chronic prostatitis, I suggest is to usually those people will respond with a long-term antibiotic. Those people should take the antibiotic for at least 3 to 4 weeks. Usually they respond with the antibiotic. But if he is having severe symptoms with the prostatitis, then he may require surgery. That should require the evaluation. So I think he should visit once for the clinical evaluation.
Right. Thank you. We have a question from Mr. Brij Duggal, who's 80. He has no problems at present, but his family doctor has been giving him silodicin, 1 tablet at night for the last 8 years. Is it correct to have this tablet? He asks.
What I understand is he is having
no
BPH symptoms, so he must be taking the prostaglandin as suggested. So, how much normal urine he told. So usually we see in the ultrasound pre and post void, means after passing the urine, how much urine is retaining. If it is less than 1/3 of the pre-void, that is normal. If the pre-void and post-void we should see. If the post-void is more than 1/3 of the pre-void, that is significant PVR. Means post-void density is more. Second is.
Sorry, doctor. This is a question from Mr. Brij Duggal, who says he's had no problems at present. His family doctor is giving him silodicin, 1 tablet at night for the last 8 years. And what he wants to know is it correct to take this tablet?
Yes, sir. If he is happy with the silodicin, he should continue.
Right. Thank you. Yeah, we'll come back to this question, which is by another question by Mr. Ravindranath. He asked, what is the normal volume of urine stored in the retention after urination? His doctor is advised to take a capsule, which is Prostagrat D8 per day. And what he wants to know is, what is the cost needed to undergo surgery and removal of the prostate gland? I am frequently urinating during rainy days.
Okay, sir. I'll answer this. So that's what I was telling. The normal volume is post-void residue should be less than 1/3 of the pre-void. Means whatever the urine he is holding is that is pre-void. After passing, that should get empty. If the more than 1/3 volume is retaining, that is significant PVR. For those, treatment is required. Second, he has told he is taking Prostagard 8. That's okay. The cost usually in Fortis Hiranandani for TRP is around 1.5 to 1.6 lakhs. So second, he is asking, he is feeling frequency during the rainy time. So that's what I told in the slide. Key cold environment or cold fluids or these caffeines, those all are bladder irritants. So whenever bladder get irritated, it causes the frequency. So try to be in a warm environment as much as possible.
Right. Thank you, Doctor. We have a question from Mr. Satish, who's 78, and he's been diagnosed with BPH about 3 years back and advised Urimax D once a day. PSA is less than 1 for the last 3 years. He has no symptoms at all now. His question is, can he stop the medicine or continue medication lifelong?
No, sir. He should continue the treatment. He should not stop the treatment. It's like if he's happy with the alpha blockers like Pirimax, he should continue. If he's not happy, if the symptoms are recurring, if the bothersome symptoms are present with the tablet also, then he needs surgery. Right now, I feel he should continue the tablet.
Right. Doctor, there's a question from Shamla Ravi, who asks, what is the chance of BPH becoming malignant if not treated in time? What is the scope of genetic engineering using gene therapy for prostate cancer?
Okay, the chances of BPH becoming malignant, it's not like a BPH is a risk factor for CA prostate. So there are very conditions. We detect the cancer in BPH simultaneously. Patient come with the retention, we diagnose as the enlarged prostate, but on evaluation we find the CA prostate. It is not like that BPH is converted into the CA prostate.
Right. Thank you, Doctor. We have a question from Mini Gogia, who asks, what are the side effects of catheter?
Catheter, usually we keep it for, there are multiple conditions which we insert the catheter. There are medical conditions. If the patient is bedridden or sometimes because of the nephropathies, they require the urine output monitoring. For those, immediately we can remove the catheter. Bedridden patient, for prolonged patient, neurogenic bladder patients, we might keep the catheter for prolonged time. Such cases, there are chances of side effects, like if it is the catheter is more than 1 month, 2 months, like recurrent urinary tract infection, or patient can develop the bladder stones or recurrent pyelonephritis. All those are side effects of the prolonged catheter insertion. Usually for BPH patients, we can treat the retention and we can remove the 3 to 5 days. If those are not getting relieved, then they might require surgery.
Right. Doctor, there is a question from Katie Dadanchi, who says, Doctor, why does the prostate gland enlarge with age, and is there any way to prevent it with medication? What is the reason why seniors have mild pus in the urine? And there's a similar question from Mini Gogia, who also asks, can a person who's physically very active, can he get prostate cancer?
So there are chances of getting. Only thing my advice is, after the 50 years, yearly they should undergo the PSA testing for the detection of the cancer. That is the best way, and that is the recommended things for the CA prostate.
All right. And is there any general medicine that a person can take to prevent prostate problems?
It's not like the prevention, sir. Those are age-related problems. If they are detected, then we need to treat them. No specific, it is not no scientific proof that there no vaccines are there, prophylaxis are there, nothing like that, sir.
Right. Doctor, there's a question from an anonymous attendee who says, who's male 74, if prostatomegaly and also fatty liver and umbilical hernia, what are the implications?
I think he might be asking for the treatment for all these things. For prostatomegaly, definitely he should undergo evaluation and treatment for the prostatomegaly. Umbilical hernia definitely requires surgery, depends on the size of the hernia. And all these three things are not correlated.
Right. Thank you. And this is from Ram Raghubir Tiwari. Because after my prostate removal surgery 2 months back, I sometimes feel burning sensation in the penis, which subsides after a few minutes. What do you suggest? He's 74 and he has no problems in urination.
So he must be, there might be chances of getting the urinary tract infection in post-operative period also. Usually we treat the patient like urinary tract infection if present before the surgery. We treat it, then we take the patient for the surgery. If the residual infection is there and we do the surgery, then the what patient is telling, the sufferers will be like this. Even after the surgery also there will be mild burning sensation. These are all because of the residual infections, and they requires the treatment like antibiotic for the prolonged time is required for those patients. I think he should visit the primary surgeon for that thing.
Right. We have a question from Mr. Sushil Kumar, but before I even address this to you, I would advise that, specific specific comments on medicines, etc., are best asked to the doctor directly, after a clinical examination or while physically meeting. But anyway, I'm going to ask this question to Dr. Sankapal. This is from Sushil Kumar, who's 76. He has been taking Budimax D, and he has problems of urinary continence. He took Roliten, but it's not helping. Please advise any change of medicine.
So I don't want to advise for the change in medicine, but I want to see why he's getting incontinence. There are lots of causes are there, whether the bladder issue is there, or he might be having the overflow incontinence that might be causing the incontinence. We need to evaluate by doing the ultrasound, in which we will come to know the post-void residue, how much urine is retaining. Based on that, we can change the medicine, or we can reduce or increase the dose of the present medicine. So I feel he should get evaluated for those things.
Right. Thank you, doctor. I think we've done with most of the questions. There were a few questions that came in which are not really pertinent for this session today. Well, there's just one thing which is coming, which is from Rajnikant Gilani. He's 70. He's a diabetic. He's required to get up in the night, some 3 to 4 medicines, some 3 to 4 times for urination. Can this be avoided or reduced to say half times by any medicine?
So the best thing to decrease it by half times is, I have already advised, they should stop taking fluid at least 2 hours before bedtime. If he is sleeping at 11 o'clock, stop fluid after 9 o'clock. He should finish his dinner, fluids, medicine, everything before 9. If he does like this, the half of his problem is resolved. What remaining thing is, he needs evaluation for the BPH thing.
Doctor, we have a question from Mr. Girish Agarwal, who, I don't know whether he's asking or he's stating it, but he says, Chandraprabha Sati is a good Ayurvedic medicine. Doctor, your view on, there are quite a few Ayurvedic and homeopathic medicines that are there.
No, sir, I am not an Ayurvedic doctor. I can't comment anything on this.
All right. Thank you very much, Doctor, for your session. We've answered most of the questions here, and some questions will keep coming in, but nevertheless, thank you very much, Dr. Prakash, for this session here today. All of you over here, you do know that the session, the edited video, will be there on the Seniors Today website on Monday evening, along with the takeaways of the session written by a medical practitioner. So these will be there on the Seniors Today website, along with all the takeaways from all the webinars that we've conducted so far. So you can have a look at the webinars that have happened, and do take a look. You can watch this video. You can take a look at the presentation once again, make notes, etc. There's somebody, doctor, who asked for your email address. I normally do not pass on email IDs to people, but in case somebody does want to contact you, what can they do?
You can share the email address, no issue. I will address the issues.
All right, great. So we will put doctor's email address with the, or do you want to give it now itself so that we can just
Yes, sir. It's a Dr. Prakash 13, DRPRAKASH 13 @gmail.com.
As simple as this. I'm putting it in the chat window also.
Yes, sir. Yes, sir. Same address. Yes.
At gmail.com. You can note it down. And for all of you over here, please remember that you can pre-register for our health webinar sessions. And the link to that is given in the chat window. You can pre-register for all our health webinars. You can download the Evergreen Club app, which you know is now part of the Seniors Today family. You can download the Evergreen Club app and take benefit of the various sessions that we have every day, twice a day, morning as well as evening. The Seniors Have Talent event is on right now. And if you want to register, or if you think somebody should be registering, remember it's only open for 60 plussers. And it's been an amazing event. We are on the 12th season now, which has been happening since the last 3 years. And if you or somebody else wants to participate in it, please feel free to do that. All the links are there on the chat window. You can take care of it. And we'll be back next Saturday, again at 5 p.m. for another session of Health Live at Seniors Today. And in the meantime, thank you once again, Dr. Prakash Sankapal, for this session. Thank you.
Thank you, sir. Thank you very much.
Thank you to the Fortis team for facilitating this. Once again, best wishes to you, doctor. And we will be in touch with you. And thank you for sharing your email address so that those who can, those who would like to take any personal advice from you can also do that. Those who want any specific advice also do that. And it's been an amazing session. You explained everything in detail. And once again, thank you very much.